Eric has always been very supportive of the East Valley stroke survivors and their caregivers. They tugged at her heart as she donated personal time to lead them in yoga practice to handle daily stress and anxiety. This led to her volunteering this past summer for a retreat and refresh stroke camp. There she was involved. Oh, was she involved in everything. From camp check-in to group activities to joyfully serving survivors at mealtime to enable caregivers some freedom and relaxation. As many of you know, she has also organized many fundraisers to help pay for people to attend this special stroke camp. Very creative. This accumulated hundreds of hours of time last year as a volunteer dancer and fundraiser for the foundation Dancing for Stroke. That fundraiser awareness and funds for rehabilitation for this special patient population. The stroke survivors and their caregivers also shared that they have different emotional, psychological, and physical needs than others, given all that they have gone through. They honor Erica's incredible intuition, capacity for love, as she meets them with special smiles, hugs, and affections. That is the most special gift of all. Congratulations.
Thank you. I think if you have the environment to support going above and beyond, it helps a lot to really open yourself up to find those opportunities to serve. It's beautiful to be acknowledged or even noticed. I wasn't expecting to be awarded this beautiful honor. It's an amazing feeling to be noticed.
Jana was working in the observation unit in January and received a patient that had been admitted for high blood pressure, abdominal pain, and complaints of weakness. After receiving the patient from the emergency department, Jana did not have a good feeling about this patient's condition. The hypertensive condition was lessened with multiple medications, but her gut told her there was something else going on with this patient. After informing other team members on the OBS unit of her concerns and contacting the physicians on the case, she seldom left this patient's bedside. Although there was no imaging to show any reason for additional concern, Jana called the patient's physician. The physician arrived and assessed the patient, and he shared Jana's concerns and further ordered imaging studies that reveal multiple locations of aortic dissection. The patient went straight to a CAT scan, from CAT scan to the intensive care unit, and was transferred to Chandler Regional for emergency surgery. Without Jana's keen assessment and persistence, the physicians and her coworkers feel that this patient would not be alive today. And we received many, many nominations and notifications, including from the ICU intensivist, the surgeon of the patient, that what she did saved this patient's life. We need more people on our team like Jana.
Honestly, it choked me up. I never expected to be so choked up. You do your job every day, and you come to work, and it becomes just your life. And then this award is the above and beyond and unexpected, and just, I feel so good.
I want to share this story with you. Many of us, when meeting or seeing homeless people on the street, might pass them by or even put on our shades as we drive along, or we might give them some money or a one-time meal. Kim, however, had something else in mind when she met a mother and daughter who recently moved to Phoenix and found themselves homeless and living out of their car. First, she found them short-term housing and some gift cards for the necessities. Then, as her enthusiasm for helping this mother and daughter grew, she engaged doctors, friends, and coworkers. Led by Kim, they used their network to find the mother a job and then a place to live, including 2 months paid rent. This even included furnishings and household items. Kim used this opportunity to show her children, and really all of us, how human kindness can truly be life-changing. The fund and friend-raising total was over $5,000, including the rent in a very short period of time. The human kindness that Kim showed was priceless. We are lucky to have such an example of loving human kindness as Kimberly Planks on our Dignity Health team.
It's an honor, an unexpected honor. For 3 years, we've held a community charity event kind of through our emergency room. I selected a single mom and her daughter who were living out of their car. They had a need, and it was bigger than anyone can imagine. I'm absolutely blessed to be able to make a difference.
Kimberly is a passionate advocate for excellent patient care, and she's a first-rate clinician. She always spends the extra time researching and checking on medications and learning about new medicines, especially for infectious diseases. Her colleagues talk about Kimberly's leadership and her passion for the hospital's efforts to improve the management of blood glucose for patients. She is very involved with our glucose initiative team to improve patient outcomes and reduce the incidence of hypoglycemia and hyperglycemia. Kimberly's excellence was recognized by the American College of Clinical Pharmacy as she was selected for their merit program, which further develops research skills. She's a tremendous advocate for our medication safety team, and she is always looking for process improvement, especially to benefit patients. Kimberly takes the time and owns everything that comes her way, frequently receiving compliments from patients and family members. Recently, a family member said of Kimberly's double-checking and actually correcting a prescription. She chose to exemplify in her own way the Dignity Health value of stewardship, taking ownership for a community problem that she didn't create, but that she could solve. My family is forever indebted to you, Kimberly. Kimberly is an excellent representative for Dignity Health, and her personal above and beyond efforts have a direct impact on improving patient outcomes and improving human kindness in our workplace. Congratulations.
I honestly just feel honored to be somewhere where, number one, they recognize employees for just doing the right thing. I've been involved with the Keep Me Safe training, and just, it's been so rewarding to really help just with keeping our patients safe. And really, I really do feel just honored to be an employee here.
Barb Farmer started as a volunteer and then spent 10 years as our East Valley Volunteer Services Manager, recently retiring. She engaged both employees and volunteers, always empowering volunteers and giving them input into creating a best practice model for hospital volunteer services. The Dignity Health System office is working on a toolkit modeled off our excellent program here at the East Valley. Pause for Patients has become a national model for pet therapy. In all the programs under her leadership, Barb followed community needs assessments and innovated at the highest level. Not content on just normal patient rounding and handing out coffee and books, our volunteer teams deliver flower and kindness to each room every morning. Our volunteers have a direct impact on patient satisfaction scores. Volunteer Services has engaged hundreds of loyal participants who are celebrated monthly in a newsletter and annually at an awards dinner. What may be her legacy, however, is our national award-winning Volunteen honored by the Points of Light Foundation as a truly exemplary program that engages teens at a true workforce experience well beyond earning service hours in their honor society. In fact, one of our doctors currently working at Chandler Regional began as a Volunteen years ago, which is a great testimony to Barb and all her service. Yeah, thank you. Congratulations. Yeah.
You know, to think about being called back from retirement to receive that award by the Marreels, who I worked with so many years, just to make me cry to even think about it. It made me feel validated for all the hard work over the past 11 years, and it makes me feel like what the volunteers do on a daily basis matters to the hospital and to the foundation.
I've got the opportunity to know and work with Marge, and I believe she truly is an angel, and I'm going to explain a little bit why. She serves as a team lead in the gift shop at Mercy Gilbert on Wednesday evenings, which she absolutely loves, and she adores meeting and helping new people. While she has logged over 1,500 service hours, Marge is being honored for a very beautiful, sacred moment that she spent with a grandmother and her 2 little granddaughters. One afternoon, they arrived in the gift shop to purchase something for the little girls to give to their mother. After making their selections, they went to the counter, and Marge could tell they were visibly upset and had been crying. Marge asked if they were all okay and if there was anything she could do to help. The grandmother pulled Marge aside and whispered in her ear that her daughter, the little girl's mother, was a patient in her hospital and she was dying of cancer. Marge immediately walked around the counter to give the grandmother a hug. After getting permission from the grandmother, Marge immediately went and purchased 2 little angels from the gift shop and gave one to each of the little girls and said, "Your mom will always be with you, and these little angels will help remind you of that." Marge has continued to purchase these little angels from the gift shop to share her mission of human kindness and compassion with everyone in hopes of making their day a little brighter and to let them know that she is loved. And we care and we love you, Marge Carpenter.
Thank you. That was amazing. First of all, it was really emotional because my daughter had been diagnosed with stage 4 cancer and given less than 2 years to live. And at the time, my granddaughter Tatiana was the same age as the little girl who came into the gift shop. So every time I think about that story, it kind of makes me choke up a little bit. And to hear it actually read and to think that I have my daughter and my granddaughter has her mom and this little girl doesn't have her mom, it's really an emotional thing. And I still think about that girl and keep her in my prayers.